Good morning, everybody. Sorry that I can't be there today in person, but I'm glad to be here with you virtually. And in a short moment after this presentation, I'll be there for the live Q&A, where I look forward to lots of feedback and lots of questions and lots of stimulating discussion. I'm here today representing the Meadows Mental Health Policy Institute, and I'm here to hopefully bring some interesting new ideas to your region of Texoma. And I look forward to getting to see you in person sometime to see all of the things that you're doing there. My goals for this presentation are a couple. I want to offer you a new narrative for action. I want to try to reinforce your collaborative intent. I recognize that almost baked into what you're doing, you want to be interdisciplinary. So I want to reinforce that. I want to propose that your mental health strengths and weaknesses of your region are within the context of a changing economy. And I recognize there is significant change going on with the Texas Instruments factory and presence increasing in your region, which is wonderful, but of course brings certain challenges. And I want to give you some new ideas for potential brain health initiatives in your region. So I hope that this is stimulating to all of you. I hope that it means something to each and every one of you. Thank you very much. So to mention from the beginning, I actually grew up in Australia. So I grew up in rural Australia in the northeastern part of the country. And I would say that the socio-demographics of where I grew up are very similar to Texas, very similar to the Texoma region. I grew up, my state of Queensland is probably the size of Texas. It's only got about 4 million people as opposed to 28 million people in Texas. So extremely low population density where I grew up. I did my medical training up in that part of the country, in that part of the world, and then ultimately started training in psychiatry. It was my field of expertise after medical school. And you can imagine when I transitioned from clinical psychiatry, clinical mental health into neuroscience, I was fortunate to receive a Fulbright scholarship. I landed myself in Beverly Hills studying at UCLA. It was a huge culture shock, to say the least. And I thought you may appreciate this story about kind of how I got to the US in the first place. I since went on and lived in Houston for 4 years. And now I'm in the San Francisco Bay Area and looking at opportunities to move back to Texas now. So I've gotten a sense of the absolute breadth of the United States. I've alluded to this. I've worn many hats. I've trained in medicine, psychiatry, neuroscience. I did move then into the business world. I co-founded a company that did genetic guidance of depression medications to try to reduce trial and error for people struggling with depression that are on medications, try to get the right drug at the right dose at the right time for the patient. So I was a kind of entrepreneur, grew that company up. And now I'm really working partly in the business world, looking at new ways of investing in mental health technologies. I'm glad to talk about that field if you're interested. And then I'm also working in policy with Meadows and thinking about new approaches to policy. How do we reimagine our societies around the brain, and how do we try to develop better economic arguments for investing in mental health? So because of my breadth of kind of experience coming in, I'm kind of a transdisciplinary thinker or a convergent thinker, if you will. I recognize that we have a lot of brain challenges in our society. And I guess the question for you guys as you see this list is like, which ones are relevant to Texoma? And maybe all of them are, maybe just some of them are. You know, brain challenges, when we think about the confluence of these things, are a big deal, right? Stress, misinformation spread, tribalism in communities from a political perspective can be kind of tearing at the fabric of society. We've had education disruptions due to COVID for kids across the educational spectrum, from junior school, middle, senior, and into tertiary education. Obviously, depression and anxiety are big issues. And then even now, things like Alzheimer's disease in the older adults. So my kind of contention is that we have a lot of kind of assaults on our brain. and the confluence of these assaults, how can we really sustain this for a lot longer? To me, this says that the work that you're doing with your leadership group and with your consortium is super important. So you guys are, I think, the most important people in the region for really trying to optimize the well-being and the productivity of your citizens, because this stuff is not trivial. And I do think that all roads lead to the brain. I do think that mental health issues, education issues, it's that confluence, right? It all does lead to the brain. And so you can see I'm laying the groundwork for this way of thinking about the brain and the economy. I think that in the modern economy, if we see here as this kind of dinner plate on the right, many issues haven't been factored into our economy, right? Climate issues haven't traditionally been factored in, but we know that sort of climate challenges are accelerating, tornadoes, hurricanes, fires, etc. Little viruses that can pop up out of nowhere and shock the global economy haven't been factored into the modern economic thinking. And certainly brain issues, I argue, haven't really been front and center in economic thinking, which is a problem, right? Because these brain issues sag productivity, they sag well-being, and so they can really dampen the economy. So I think, again, I'm trying to lay the groundwork for the importance of what you guys are doing. It needs to be front and center in the economy and in thinking. We know that traditional economics thinks about GDP, right? But we know that GDP measures everything except that which is worthwhile. So what could we do to add to GDP or extend it that sort of puts brain issues front and center? Because GDP is okay, but it doesn't really give us a general sense of the community. So in summary, of course, I'm suggesting that our brains are left behind in policy, in economics, and in investing. And I'm so glad that you're doing the work that you're doing in the Texoma region to try to fix this. Because if you don't keep pushing for change, then where does this lead us? It's kind of pretty sad future if we don't empower you to do your best work. So yes, let's put our brains at the center of the economy. Let's celebrate your work. Let's celebrate the different people in society that are touching on our brain health. Let's celebrate school teachers, police officers, mental health clinicians, caregivers. All of these people need to be applauded, I think, for the betterment of your community, for the state of Texas, Oklahoma, and for the country. So laid the groundwork, of course. So what's the kind of solution? Well, I think this brain capital as a new platform for change, brain capital as a new narrative, brain capital as a new economic asset, like a brainy version of human capital. I think this is a way of getting at some new solutions. And brain capital is brain health and brain skills in the brain economy. Very simple. Brain health plus brain skills in the brain economy. And I'll break that down for you. And this is a lot of this kind of work we're doing now at Meadows to try to pioneer what does brain capital mean to the state of Texas, and how do we prioritize this, and what is action going to look like. This is the kind of quest that I'm on with Meadows, and I would love to keep you tell you where I'm up to now, but then keep you on the journey in the next couple of years. The brain economy, what is it? It's obviously the title of my talk was about flourishing in the brain economy. I think the brain economy is super relevant to Texoma. It's an economy where you've got lots of brain challenges that we talked about before. It's an economy that increasingly demands cognitive skills, like the Texas Instruments plant that's coming in is going to demand cognitive skills. The brain economy is an economy where innovation is critical when you're an employee to your value as a productive employee. Generating patents and process innovation and supply chain innovation and just generally being creative, that's kind of important now, right? And I think it's probably going to get more and more relevant to the Texoma region. The brain economy is also one where stigma rates are falling, and this is a good thing. I think since COVID, we've seen that more people are willing to talk about, brain challenges, mental health challenges, isolation, anxiety, all these types of things. So that's positive, but that also means that people are coming out of the woodwork seeking help, and we're being kind of overwhelmed as clinicians to try to help people. at the rates that they need help. And the brain economy finally is an economy where neuroscience discoveries are increasing. Sure, not a week goes by when you're not reading the news, you see some kind of new neuroscience discovery. This is a good thing. So the brain economy has challenges, but also has opportunities. And this is the kind of canvas upon which I think that the Texoma region is in, and it's kind of the world we're moving into, right? Because all these things are kind of accelerating. Brain health is really, for me, a way of incorporating mental health issues and neurological issues across the lifespan, from ADHD in kids, depression in adults, to Alzheimer's disease. So that's brain health. But brain health is also, how do you look beyond just the deficit model of mental health to say you're depressed, you're anxious, you've got problems. Brain health also brings in strengths. How resilient are you? How wise are you? What are the strengths that you have? And we all know that people that have mental health disorders have sort of deficits, but those have tremendous strengths. Many of the most inventive people in history have had bipolar disorder, for example. People with bipolar can have these amazing creative flashes that many other people don't have. And so let's try to be a bit more balanced, right? Thinking about the pros and the cons of mental health. And so brain health is a moniker that I would offer to you to try on. See if you like it, see if you don't like it, but it's an interesting new framing. Brain skills are really just skills that are important to the modern economy. Resilience is obviously an important brain skill. Think of what we've been going through in the last 2 years as a country with COVID, and COVID virus issues and politics, all that sort of stuff. You've got to be pretty resilient to sort of hang in there. And how do we build people's resilience? You've got to be adaptable. That's an important brain skill. You've got to be a problem solver, because the world is changing so quickly that problems come up unexpectedly. You got to be able to try to solve them for yourself, for your loved ones, for your family, for your community, for your business. And creativity, of course, is an important brain skill as we try to navigate this complex world. So I argue that if we get back to brain capital now, as brain health and brain skills and the brain economy, I argue that there is an existing inequality on the left-hand side here. You can imagine, if you think in your heart of hearts, there is a gap in brain capital in society. Some people have it and some people don't have it. And typically the people that have it, they're more fortunate. They're perhaps a little bit more affluent. They have more means. They have more education. They have safer households. I argue that this inequality is probably going to increase in the future if we don't really think hard about how to narrow this inequality. If you're a person with brain capital means, as the world cranks up in its intensity, you're going to probably be able to stick with it, right? You're going to be able to do cognitively intense work. You're going to have a higher income. You're going to probably go and get extra education here and there as you can, get a coach or whatever job that gives you education. You're going to feel good and confident. Conversely, if you're someone that's kind of struggling with brain capital, if you will, you may not be able to keep up with the modern economy. Automation, robotization of jobs or offshoring of jobs overseas. These things you may be out of a job. And when you're out of a job, you're out of your purpose, significantly out of your purpose. Work is important for a purpose. And then if you're sort of down on your luck and you don't sort of know what to do when you wake up and some things to look forward to during the day, you could get anxious, depressed, and then you're less likely to go and get upskilled and reskilled to get back into the workforce. So one of my arguments is that focusing on brain capital is key, because otherwise this inequality is going to rise. Brain capital, let's think about across the lifespan. I'd be curious to see what you guys think about this. Brain capital, as you can see, we've got prenatal, when you're in the womb, all the way through to older adult on the right. Where does your job take you in this journey with the people that you care for, and where are you in this journey? We can see here that brain capital is almost like an accruing asset that accrues and gets highest in adult life, and then wanes in later life. The red things pointing down are things that are decreasing brain capital, and the blue things are going up, increasing brain capital. What can we do as individuals? Pardon me. What can we do as individuals to reduce the red things in our own lives and increase the blue? Exercise, diet, stress management, these types of things. And then for the patients and citizenry in Texoma that we care for, also what can we do for them? So kind of interesting to think about, where do you fit on this nexus, yourself personally, your family, and then also your the people that you care for. I argue, and I know that you guys would agree with this because I can see it in your mission, that disciplines that touch on brain capital are pretty siloed. You've got clinicians, teachers, police officers. In most communities, they're all siloed. They don't talk to each other. But I love that, and that's a problem, right? Because these issues bleed across different disciplinary silos. These challenges don't just respect some nice little bucket that you put them in. Think of a youth, a challenged youth that's come from a challenged household, and if they're getting into some delinquency issues, they're skipping school, they're try to get them a therapist, they may not see the therapist, they get involved in the justice system, the judicial system. We need to kind of come together to support these types of individuals, because if we just deal with them in one way relevant to our discipline, it's not satisfactory. So what can we do? Let's be more interdisciplinary, just like you guys are. So let's celebrate what you're doing, and let's look for ways to ramp up the way that you collaborate with each other. And then now at a societal level, what can we do in the Texoma region to boost brain capital? Well, I'm going to take you through a little bit of a lifespan approach here, starting in early childhood brain development. I encourage you, if you haven't seen this TED Talk, to check it out. You can Google it. You'll find Molly Wright and just look at the title of the talk. This was the most popular TED Talk last year in the world. Molly is a 7-year-old Australian girl, and there was a big production studio behind her to make this, but she does a great job basically talking about how can you protect early childhood brain development. She talks about strategies from her perspective that you can use. So it's great when a young girl is presenting this type of message. You'll enjoy the Australian accent. My Brain Robbie is another program which I would encourage you to look at. This is more for childhood now. What can kids do? This is a kind of animated program to speak to kids. What can they do to look after their own brain health? Exercise, diet, preventing head injuries, sleeping, not smoking. Very interesting. Again, you can Google this one and check it out. It's quite compelling and quite easy to watch and quite fun. Could this be relevant to your region? One of the other things I want to mention is that your brain could be a national security risk. We know that people that are kind of down on themselves spiritually and emotionally, maybe they're of lesser means, they're of less educational attainment. These are people that are at risk of being misled by misinformation and disinformation from the modern news and social media platforms that use algorithms to sort of take people off and self-reinforce their views and sort of give them more and more sort of fear-driven and radical. This kind of the way that these companies are set up economically is to do this. And so your brain can become a national security risk, because if you get sufficiently radicalized, you might start to see citizens in your neighborhood as the enemy. And then you might, that's sort of, you've all seen this, right? The tension in America right now is really high. And so how do we start to really think about reducing this, reducing despair, and trying to give people ideas about how to discern fake news from real news and get better quality news insights for themselves, so they can stay much more in a sort of realistic mindset. I'm glad to talk about this further, and there's some work we've done with the Brookings Institution. You can read that report. Also, I think at a big national governance level, We've thought about brain capital issues relevant to the United States. This is a overview here of the executive offices of the President of the United States. In black, we have the different executive councils, and in blue, I've outlined how brain capital is relevant to these. In domestic policy, this brain capital gap that I talked about, that's only going to widen. Gender policy, we've got women are struggling much more with mental health issues than men, by far and away, because historically research has mostly been done in men, and we have a much better understanding of the male brain than the female brain. We can talk more about that. The Council of Economic Advisors, how much does the Council of Economic Advisors really think about these mental health issues? So I'm concerned that brain capital slips between the cracks. So what we proposed in this particular paper that we published with the Brookings Institution is that we should have a brain capital council. Imagine if we had a brain capital council in the White House. That would be an interesting way to sort of integrate the horsepower of the United States government behind this issue. Question for Texoma is, what could you do at your regional level to try to address this and think about this? Love to discuss that and get your thoughts on it. This just more of the work we've done with Brookings. I can share podcasts or any of the papers that we've written. You can read more about it, and that can enrich the discussion. To say maybe as a final couple of points now that we're humans, we're all humans, we're not perfect. We know we strive to be perfect, but we will never probably get there. We have a lot of cognitive biases. We often think short-termism. We're often not in the present moment. We're worried about the future. We're worried about the past. We're remorseful about what we did in the past. There's a lot of sort of tribalism. They call it in-group, out-group thinking. We all know that we have certain cognitive biases, and as try as we might to not have them, they do slip in, particularly when we're tired and stressed, right? So one interesting way of thinking about brain capital in society is, how do we reduce cognitive biases? Not easy, because there are hundreds of cognitive biases, but it's an interesting framing that I've started to think about in the past and recently. So just relevant to cyber safety and cyber crime and cyber exploitation, I'm sure that particularly the police officers in the audience are aware of cyber crime that goes on in your region. Often the cyber criminals are hacking human cognitive biases. If we take, for example, in the cyber realm, the Dunning-Kruger effect here on the top right, we overestimate often our level of competency, particularly the men in the room. We overestimate our level of competency. I know that I probably do. And so what does that manifest in, that cognitive bias, in employee behavior in the context of cyber hygiene? Well, it means that we overestimate our ability to spot a phishing attack. That email from the Nigerian prince that's saying he's got $10 million to give to you and he just wants to transfer it to your bank account. We think we know how to spot that all the time. And we assume that we'll see, dodgy or shady emails in our inbox, and we'll know them. And we mostly might be right. But, again, when we're tired and stressed, we may miss things, and you may click on something that you shouldn't. And some cyber criminal gets access to your company's secure intellectual property and commercial data. And that's a massive problem, right? So, again, what I'm trying to do here is frame that even things like cybercrime and cyber safety are related to brain capital. These are important brain skills that we need to develop and think about the role of our brain in society. I hope this is useful to you as a case example. So again, in summary, all roads do lead to the brain, and hence brain capital is important, from early childhood brain development to education. I did actually write a book on interdisciplinarity or transdisciplinarity, fusing different fields together, published about 12 months ago with Oxford University Press. So I'm all about interdisciplinary collaboration and really respecting what you guys are doing in Texoma with your leadership group and with your consortium there. Keep going. And, this book may be useful to you in some regard. I'm happy to share summaries of the book. obviously talked about we want to reduce this inequality in brain capital, which means we need to think across sectors and across different parts of the community, public, private, nonprofit. What can we do in the Texoma region to reduce this brain capital gap in the future is my challenge to you. Brain capital, just again in summary, is this new, whatever we want to call it, theory of change. It's a new narrative. It's a new platform. It's a new economic asset. Could this be useful to you, at least as a thought experiment? Maybe you're already doing all these things. That's fine. But at least this gives you a way of sort of thinking through, are we doing everything that we can be doing? And to say that this is obviously a big, broad canvas that we're talking about, the brain economy, and where we all fit in the economy, and particularly in your region. But we all have a responsibility to do something about the well-being and productivity of our community. So what part of the canvas do each of you want to own? And how can you in the Texoma region coordinate who's owning different parts of the canvas? And I'm sure you're already well on the way to doing this. You might already have nailed it. So where to from here? Have I stimulated any ideas for you, that things you could act upon, do better in your job, or just double or triple check? Glad to discuss and get your feedback. And now I'd say thank you, and I'm looking forward to questions. If you want to reach out to me afterwards, if you've got other trailing ideas or thoughts, I'm on LinkedIn, or here's my Meadows email. Thank you very much, and let's get to discussing Q&A. Thank you.
All right, so if you have questions, send those in. We're going to live stream. Oh, there he is right there. Welcome, Dr. Eyre. We're glad to have you. I don't know if you can see us, but we see you.
Yeah, I can't see you guys, so it's just one way, unfortunately. I wish I could, but good to be with you, Larry. Thank you.
Well, these are good-looking people out here. They're smart. They have a lot of brain capital and a lot more than I do. And we sure enjoyed your talk and the challenge that you've given to us. And so I'm going to try to use my brain capital on this iPad again. I've been having struggles with it, and see if we have our questions. Okay, I don't have any questions up there yet. Oh, well, there we go. All right, so do you have anything you want to share with us before we ask questions? Anything?
No, I'm just sorry that I couldn't be there face to face today. Very, very unfortunate. I look forward to coming out there and seeing you guys soon. But I'm really glad to answer questions and brainstorm about this topic.
So, do you are you in a tree house right now, or your virtual background is lovely?
Yeah, this is my virtual background. It's getting a bit of green therapy. Like I'm tricking myself like I'm in a forest, even though it's a fake background.
Okay, I'm going to ask the first question. How early should we be thinking about brain capital and child development? And is there a way to introduce this in our school system?
Brilliant question. You can start thinking about this in utero during pregnancy, when the fetus is still the fetus. We know that air pollution actually has a deleterious effect on the fetal brain when you're in the womb. So the strict answer to the question is we can start thinking about it in utero. And of course, we all already know, right, that like cigarette smoking harms the fetal brain. So that's when we should start thinking, and certainly thinking about perinatal mental health is really important for the mother and also the father, because parental expertise and skills within just even the first few months of life are important. So that's how early you can start thinking about this and some ideas. And then relevant to schools, I think that Meadows Mental Health Policy Institute is very well placed to talk about some school-based sort of mental health programs that could be deployed. They may have already talked to you about it. But then there are some other folks in Dallas that I know that are thinking about brain capital in schools. The Center for Brain Health at UT Dallas, that's run by Sandy Chapman, has a program of SMART training for middle school. That's teaching not so much about mental health, but about emotional intelligence and sort of resilience factors for middle schoolers, and how that you can sort of cope with the modern world. So there are some good local resources to draw upon to think about how to improve brain capital in schools.
So we have a question, and it says, to what extent does gut health, I don't know if they're saying that because I'm up here, hormone imbalance and vitamin deficiencies impact brain health and mental stability?
Yeah, so the gut health topic, all of those things are important. Gut health, let's take that to start with. We used to think that the gut was unrelated to the brain, right? But now we know that actually the gut bacteria, we have trillions of gut bacteria, and they actually communicate with the brain through the vagus nerve, which is this big, thick nerve that runs up from the gut into the brain. So what we know is that if you have an unhealthy diet with lots of saturated fat and processed foods and sugars and stuff, that it causes it sort of stimulates the bugs to produce bad chemicals, and those chemicals get released into your system, and they can cause you to feel a little bit down or a little bit sad or something. And conversely, if you have like the Mediterranean diet that's got lots of omega-3s and good fats and sort of slow burning carbohydrates, that's actually, the bacteria like that, and they stimulate really good chemicals. So this is a whole big field of exploration that we now have the ability. There's some early data actually show that if you can treat depressed people with healthy diets, and that's actually as effective as antidepressant medications and as effective as talking therapy. So it's a fascinating area. We've only just scratched the surface, and we'll start to see now sort of new therapeutics where you can actually personalize the types of bacteria that you give people to swallow that makes the bacterial colony within their gut healthier. So that's an interesting area. And then hormonal therapy is important. I'm not a OBGYN, but certainly relevant to sort of the perimenopausal period. We know that that's important. That there's a whole field, of course, of women's brain health. We need to look at it from sort of a premenstrual dysphoric disorder and perimenstrual issues, and then perimenopausal. Hormonal therapies are very important in that regard, but I'm not an OBGYN by training, so I won't speak too much about it, but it's really important, and maybe that would be a good topic for the conference next year, actually, women's brain health stuff.
Very good, thank you. Those are great answers. So one question kind of says, do you have an ideal interdisciplinary model for mental health in the community for brain capital?
Actually, I don't really have a good idea of that myself. I think that's something that we want to build with Meadows and build with you guys as well, if you have ideas. So I'm very open to talking about it. I think the best I could say at the moment is maybe focusing on youth in schools is a really nice model, because we know that in youth, mental health issues are pretty serious right now, and also the importance of education is critical as people are looking to finish high school and get into, after school, whether it's a trade or into university or something. So I feel like the youth sort of period of school and dealing with mental health issues is really rich, kind of interdisciplinary, where you need school teachers and therapists and stuff working together. So and I know that Meadows has a number of initiatives in that area. You guys may have locally as well, but so I think that is a nice area for us to focus on. And actually, we just published a paper a couple of days ago with Andy Keller of Meadows, the CEO of the Meadows Institute, about youth brain capital, and we put in some of those Texas initiatives about mental health in school. So I can happily share that link if people are interested to read that paper.
All right, so the question is, I think, how do you measure brain capital outcomes?
We're working on that. We have established a brain capital dashboard working group, which is thinking about this globally. And that working group is full of economists and neuroscientists and psychologists and things and educators. So we're working on it. It will probably include a composite of things. So we call it a dashboard as opposed to a single index. It'll be a big dashboard. It'll be looking at if we just took like this, your region of Texoma, we'd be looking at rates of mental health issues, rates of dementia issues. We're looking at ways of quantifying resilience in the community, creativity, and then emotional intelligence as well. So it'll be some kind of composite dashboard, but the details are still being worked out through this working group.
Well, it's tremendous to have you, and all of us get to kind of have a front row seat at truly a remarkable frontier going forward. And thank you for your work in this field, and willing to work hard and to accomplish what you've done to be able to help us understand how important it is for us to deal with our brain capital. I don't have any more questions to ask you. So if y'all have any, go ahead. But I think, do you have any closing remarks before we let you go?
I think in closing, this brain capital work is something that in the state of Texas, particularly through the Meadows Institute, we've only started really diving into deeply in the last maybe 5 months. So this is very early days. So we really want feedback, ideas, and we want to build this together. We want to build almost like a statewide approach to this for Texas, but we're focusing on particular regions as well. So just want to say that thank you for your interest, and let's collaborate on this, because it's going to take a big team approach, because these issues as described are very serious. So we need to kind of dig into it together. But thank you. All right.
Thank you very much for working with us. This was great to hear you. Everybody's going to now clap, and hopefully you can hear them through my microphone.
Brilliant. Thanks so much, Larry.
Great job, Dr. Eyre. Thank you so much.